Hi, everyone. My name is Katie Brumfield. I'm the manager of career services at the Colorado School of Public Health. And today we're going to be talking to Hannah. Hannah graduated from our school in
2016.
2016. Um,
Yep.
and if you wouldn't mind kicking it off, tell us your concentration, where you currently work, and your job title.
Yeah, thank you so much, Katie, for having me. Hannah Wynd. I graduated from the School of Public Health at the Anschutz campus in 2016 with a concentration in global, environmental, and occupational health. And currently, I am the Deputy Director at Grand County Public Health.
And for anyone that doesn't know where Grand County is, where is it?
It it is just over the mountains from Boulder for the most part.
Yeah.
So not too far from the Front Range, kind of the next county over, but definitely in the mountains,
Yeah.
rural.
Yes, yes, yes. And so deputy director, that's a big job. How big is
Yeah.
Grand County?
So Grand County geographically is the size of Rhode Island, so a lot of, land to cover there.
Yeah,
Population wise, I think we're almost up to 16,000 now, and that really ebbs and flows based on a lot of the visitors that Grand County receives with ski resorts and Rocky Mountain National Park.
yeah,
So yeah, medium size compared to,
yeah,
some of the other counties in the state.
yeah, not too bad. And then I know there's no typical day in public health,
Uh,
but if you could describe kind of like the skills you use or the tasks that you're in charge of, just what does a deputy director do?
Yes. So I was a tough one to think about, and I was like, you know what? Let's just look at my calendar. What am I doing?
Yeah, that's a
And
good way.
so I pulled up what's going to be happening on Tuesday because we have Monday off for the holiday. So Tuesday we get started 8:30. First thing, most Tuesdays we're at the Board of County Commissioner meetings, providing public health updates and updates to our Board of Health. And so my director and I are going to be updating them on, we have a contract coming forward for some money that's going towards our reproductive health clinic.
Nice.
Then we have a contract we're bringing forward for a program called Baby and Me, which is helping parents and partners quit smoking for, health and well-being of themselves and baby. So that's a new program that we're bringing forward to them to get signature on. And then the other thing we're also going to provide an update is our outdoor air quality monitoring study that we did this past
Cool.
fall and some updates on that. We've been doing some air quality monitoring at a local asphalt plant and working with CDPHE, the state health department, trying to determine, is there any potential concern here for the neighborhood? So that's been an interesting study that I've had an awesome environmental health specialist that works for us working on. Then we'll leave the commissioner meeting. Next is Nurse Family Partnership, which is another program we operate, which is nurses going into the homes of first-time moms that are in need of extra support services. They kind of follow that mom for the first, I believe, 2 years of life for that
I
child.
didn't realize it was that long.
Um,
That's awesome.
yeah, providing a lot of extra service. So that's the community advisory board I'm on to be able to meet with kind of the local NFP region on that. Lunch, which thankfully we will get a lunch on Tuesday.
Yeah,
That doesn't always happen.
I
But
can
then
imagine.
following that, I'm a board member on the Northwest Rural Healthcare Coalition,
Okay.
which around the state of Colorado, we have lots of different healthcare coalitions, which are primarily focused on emergency preparedness.
Mm,
So that's what that meeting is gonna revolve around, and that's a lot of different partners with regional hospitals, EMS, emergency managers, and then a couple of us with public health.
wow.
And then we'll finish out the day with a check-in with my public health director. So anyway, it's every day is interesting because it's lots of different programs, lots of different
Yeah.
topics. Like I said, one minute we're talking about baby and me tobacco cessation, and the next minute we're talking about benzene in an asphalt plant. Which is cool because you
Yeah.
really get to be involved in a lot of stuff and definitely something that's been awesome for me being in the deputy director role. Previously, I was really like heavy in environmental health,
Yeah.
and now it's awesome being able to, be involved in a lot of the different public health programs.
Yeah. Wow. So it's a lot of meetings.
Yes, a lot of meetings. A lot of it is, and this kind of I think might go into one of the following
Yeah.
questions, but it's a lot of community engagement where, you're working a lot with like some of the policymakers, so your commissioners, but then a lot of the community engagement with, the public themselves, or it may be like neighboring counties, or, a lot of those different like advisory boards we're on where we're, collaborating on a lot of things. So
Yeah, a lot
yeah.
of collaboration, a lot of relationship building, probably a lot of
Yes.
communications.
Yes, lots of talking.
Yeah. Wow. Yeah.
Yeah.
Okay. So now I'm curious. When you started your public health career, did you ever think you'd
Yeah.
end up here? And what inspired your initial public health career? And then how has that evolved over your career path?
Yeah. So it kind of really started from a young age. I kind of had the unique perspective because my grandma was a public health nurse at the local county health department.
So
And
cool.
yeah, and she lived across the street from the health department. And so as a kid, I'd go over to the health department and, she gave her vaccines and did this and that. And she was there for most of her career. So I at least had that exposure from a young age about kind of like what a local health department looks like and, like what she had done as a public health nurse. So I was definitely interested in the nursing field. I volunteered at my local hospital starting when I was 13. I did that pretty much all through till when I graduated high school. A lot of what I did there at the hospital, which was at the time I didn't know was very public health, but looking back on, I'm like, oh,
Yeah.
it's totally public health, was the newborn hearing screening program.
Yeah, yeah, yeah.
So it was really cool. I worked with an adult volunteer and we had gone into like all the little newborns and put the little earmuffs on their ears and tested their hearing.
Yeah.
And,
Yeah.
and so, yeah, it was interesting how like looking back and I'm like, oh yeah, that was, totally. And so there's been lots of little steps along the way. And I had continued thinking like, oh yeah, nursing, nursing. And then I had done my undergrad at CU
Mhm.
and I eventually was kind of like on the pre-nursing thing, but then I ended up studying abroad and that kind of like threw things off the tracks for, for the nursing school. And then I was like, maybe like that, like the hard, science nursing piece of it, like,
Yeah.
giving shots and like clinical stuff. I'm like, maybe that's not as much like really like what interests me.
Mhm.
And then that's kind of where I started more gearing towards the public health side of things, where I can still like heavily be involved in health and the sciencey side of it, which I love, but not necessarily be in that, clinical setting like a hospital. So that's kind of what led me down the public health path, at least.
Yeah.
And then, yeah, then I started working for a local health department with Summit County, was there for about 4 years.
And that's where
And
you
then
focus primarily on environmental health. Yeah.
yeah,
Cool.
environmental health there, environmental health specialist there.
Nice.
But things definitely kind of like took a turn, and I feel like this kind of hits on the pivotal moment
Yeah.
topic that
Yeah.
we had talked about. I mean, I'm sure many people that are working in public health, it's hard to like think of another like bigger pivotal moment than COVID for a lot of us.
Exactly.
So to go from, all right, we're doing environmental health, water quality, soil quality, restaurant inspections, to then like now we're completely shifting gears and all of us in environmental health got
Yeah.
reallocated to different needs within
Of
the
course.
emergency response. Some of us got put into contact tracing, some got put, anyway, I got put into our EOC, so Emergency Operations Center for the
Oh,
county,
cool.
as the ESF 8, which is the emergency system function that represents public health.
Okay.
So I was kind of like the public health representative in our emergency operations center for the county. And then I stayed there in the EOC for, I'm trying to think, I guess almost a year and a half.
Wow.
And like, and that's all I completely like no more environmental health stuff full time doing all of that. So that was kind of, a big shift there. And it definitely got me very interested in the emergency preparedness for public health
Yeah.
type stuff because I've really enjoyed getting into some more of that. And then another piece of that is then I got pregnant with my first son during all of that.
Yeah.
And at the time I had been living in Grand and was just commuting back and forth to Summit.
Okay.
And I was like, it's, can't keep doing this. Childcare was a whole thing. So then I ended up transferring over to Grand County Public Health and, went back to the environmental health stuff. The pandemic was starting to
Hmm.
slow down some.
Yep.
And yeah, did the environmental health specialist thing there for about a year. We hired someone else on, so then I became the environmental health manager, and I did that for another year and a half or so, maybe a little more than that. And then
Yeah.
the deputy director at the time at Grand County Public Health was retiring,
Yeah.
and my director, yeah, gratefully so, she, would you be potentially interested in this? And it's been a learning curve in terms of traditionally that role's always been a nurse.
Yeah.
Not always, but pretty frequently. And so it's been interesting to bring more of like the environmental health expertise into
Okay.
that role and still be able to like be a big advocate for environmental health within the bigger public health realm. So yeah, that's kind of how I got where I am.
I'm curious, was it hard? Not hard, but like did it feel weird, I guess, to go from like working as an environmental health specialist to now this big leadership role within the health department?
I mean, thankfully it's been a little bit of like a slow progression.
Okay. I would have been like, oh my gosh, I'm now in charge of.
Yes, but there's yeah, definitely felt that in the beginning and still feel like waves of that now. I mean, being in the role and having like the supervisor piece of it is a big chunk of my time as
Yeah.
well, and something that like doesn't necessarily always come supernatural.
Yeah.
And so having to, like lean on my director for a lot of like resources and support or other, county like leadership or
Yeah.
trying to pursue different, leadership training courses and this and that.
Yeah.
So it kind of is a skill set you have to learn that you don't
Absolutely.
necessarily come prepared with or have experience with until you're in it.
Yeah, yeah, totally. I go to a
Yeah.
lot of like leadership talks and sometimes I'm like I just don't know like a lot of it is like you just kind of have to go into it and then figure it out and see what works,
Yeah.
as a
Yeah.
leader.
Another big piece of it as well with the deputy director role that I wasn't as involved with before, but I feel like it's been like really useful to me and I feel like could be really useful for any, profession if you ever want to move into, but is like the budgeting piece of
Yes.
understanding all the money and, building out the budgets and, doing those different contracts with the financials attached to it and tracking all the financials and being like heavily involved in that piece of it has been a huge learning experience for me that I've like a skill that I didn't have before I
Yeah.
took on this role.
Are there any tools or like trainings you would recommend for to learn that?
I mean, I feel like there's some that come up every now and
Yeah.
then that, some of the different public health groups in the state put on where
Yeah.
it's, like grant budgeting 101.
Mm. Yeah.
And, some of that's helpful, especially for the grant piece of it. But
Mm.
like every single grant kind of has its own little nuances. And
Sure.
so like trying to figure that out and no, yeah.
I know.
I mean, a lot of it's relying on people that have done it for a long time and just being willing to ask a lot of those questions and patience.
Yeah, yeah.
Especially because the number thing doesn't always naturally come to me as
Yeah.
as well as it might for some other people.
No, it does not come natural for me either. And I keep trying to
Yeah.
look for some trainings for our students because I do think that that's really important to just even understand how it works. Like,
Yeah.
you know,
Yeah. Yeah, and it's something that we're even trying to work on doing more training just internally with our staff so that it's not like, just a few of us that have the knowledge of how it all is paid for and functions. So
yeah,
like everybody in the department has like a good understanding or at least a foundational knowledge of like
yeah,
this is how my time is built for this. This is, where the money comes for this part, just some of that is super helpful, I think. So
yeah,
it's a work in progress.
yeah, yeah, yeah.
Yeah.
Um, and are there any like associations or groups or trainings or extra things that you would recommend that have been helpful for your career path?
Yeah, definitely when I was, deep in the environmental health stuff, and I'm still a member and go to the conferences, but the Colorado Environmental Health Association, CHA,
Yeah.
is great. I was on their board for a little while too. Excellent group of people. The conferences are awesome, and they also offer all sorts of different kind of trainings throughout the year. So they're a great organization to be a part of. Um, being in the deputy director role, now a little bit more involved with CALFO, which is the Colorado Association for Local Public Health Officials. It's a
Hmm.
long one.
Hmm.
And they're a group that meets very frequently, a lot of communication, really advocating for public health needs, connecting a lot of the counties to each other. So they're a great association. And then they're also involved with, I think it's technically the Colorado Public Health Association, but puts on public health in the Rockies
Yep.
each year. Which I'm sure there's probably lots of students that go to that as well. So that's a great one. And the other one that I was actually at this week, so many acronyms with all this, but SEMA, Colorado Emergency Management Association.
Oh, I've never heard of that one. Wow.
Yes, and so that was the one I was at this week, which is
Okay.
up in Loveland, February of every year.
Nice.
And that's really for a lot of us in public health that are very much involved in the public health emergency preparedness
Yeah.
piece. So yeah, it's been a great one too.
Yeah.
And
No.
then I'm trying to think other trainings. It's the can't there's what it's what I mean. There's so many names and acronyms,
No,
but there's another like Colorado Public Health Training Center or
we
something
have
that
the
they're always
Rocky
sending out.
Mountain Public Health Training
Yes.
Center. Yeah. Yep.
Yes, that's the one I'm thinking of. And they always, I mean, they have so many trainings they're always emailing out that a lot
Yeah.
of our staff participate in
Yeah.
those.
Yeah. They have a lot of really good trainings. And then
Yeah.
there's also Rye Hill, the
Yes, that's another good one to
yeah.
mention as well.
Yeah,
Yep,
that's
they offer some great stuff.
yeah, environmental leadership, I think. But yeah.
Yeah, I think definitely kind of their focus, but I know lots of people that are not involved in
Yeah.
environmental health that have done a lot of the right health stuff.
Yeah, yeah, same. Yeah, no, they have a good like leadership like program, I think that you have to
Hmm.
apply for. Which is
Yep.
cool. Okay, what else we got here? How so because you have so many programs you're overseeing and having to like stay up to date with everything, what are your resources? Like where do you go to get information?
In terms of like updates and stuff on
Yeah,
things.
yeah. Is it just a ton of
I mean,
emails or
definitely, there's always a ton of emails. But sometimes it's good to hear the updates from multiple different places.
true?
I feel like those like group meetings we do with a
Yeah.
lot of so there's another group that's called CDEH, Colorado Directors of Environmental Health.
Oh,
We just had that one a couple weeks ago, and that's quarterly we meet. And we do that for 2 days, and for the most part, they'll bring in lots of different folks, but for the most part, it's CDPHE representatives.
yeah.
So like the water quality division manager, the division manager for environmental health and sustainability, and like they come in and provide the directors a lot of updates. And so that's one thing where those types of meetings are really beneficial to understand so there's new things happening within CDPHE, this new requirement,
Yeah.
and then be able to have not only hear it from the CDPHE representative themselves, but then also be in a room of all the other directors in Colorado and have that discussion of like, how are we going to do this? How are you going to do that?
Yeah.
So a lot of those groups are super helpful for
Yeah.
keeping up to date on things.
How do you manage your time? Like, do you have to like block off a no meeting day? Like, I'm just like, I like, when do you get to sit down and like focus on projects?
Yeah. Yeah, that part can be challenging.
Yeah.
Fridays are really great for me because
Nice.
it's the day that I'm not in the office. I'm
Yeah.
in the office Monday through Thursday. And so those days where I'm not necessarily in an office, like, where I'm helping with people coming in, our door needing different services or running around and doing this and that. So I mean, it's tough because there's some weeks where I can say like, no, I don't get any time to sit down and like have any focus time. But
Yeah.
then there are some weeks where it's like, okay, we do have a day that
Yeah.
we can get caught up on some things and then get back in it. So I wouldn't say the balance is always perfect. It's
Yeah.
always a priority. Um, but yeah, that's always a work in progress. I think,
Yeah.
I've always told myself is like there's always gonna be more work. And so sometimes I think like, oh man, if I just sit at my computer for another hour and get this done, like I'll be good.
Yeah.
But no, there's just gonna be more. So if I can like take the 30 minutes to step away and go for a walk outside,
Yes.
it's normally worth it. It's always worth it.
Absolutely. Yeah. Always worth it. Yes. I
Yeah.
think that's great. It's kind of public health. You're juggling a lot of different priorities and tasks and deadlines and
Yep,
lots of
absolutely.
things. All right. So my last question here is what advice would you give someone that would like to pursue a career in what you're doing?
I think a lot of it goes back to just the relationship building. And, it can be something as simple as just like getting to know one of your professors. Because what's super cool is like everybody that, I mean, I learned from at the School of Public Health was like involved with so many different things and so tied in
Yeah.
to public health within Colorado that it's just been interesting, even in the past like 10 years of working in public health, where I'm just like, oh yeah, like you were my teacher, like, or, like I had met you through this. And, it doesn't have to be anything like official, but it's just,
Mhm.
being, and even just the students you are in classes with, I mean, end up doing really cool, amazing things too, where, you follow each other on LinkedIn and then you all of a sudden see so and so's doing
Yep.
something, you're like, oh, and then that could come in handy too one day. Or I had done my capstone and practicum at the EPA. And I mean, that has come up before too, like when I've, been looking for like job recommendations or references, to like be able to rely on them for some of that stuff, like when I was just getting started. And so it's just the little relationships. It doesn't have to, like I said,
Yeah.
anything, big and official. Just yeah, just get to talking to people, let people know what you're interested in doing because they're gonna know somebody. And it sounds simple, but I feel like it really is how you get to most things.
I agree. I agree. And it takes time and it takes, really putting yourself out there to build those relationships. Yeah,
Yeah, that really is a big piece of it too, or maybe it's not the most natural thing to you to
yeah.
be putting yourself out there. But it will pay off at some point, one way or another.
And the public health world in Colorado, I feel like we see the same people, like it's very small to me. Every
Yep.
time I go to public health in the Rockies, it's like, oh, are you still there? Are you still here? Like you start to
Right.
just start to know everyone kind of. Well,
And I mean, for the most part, most of us have been with like, maybe an organization or two, or
exactly.
like whether it's not a public health department and another organization that's been involved. And so like you'll still see the same people one way or another.
Yeah, totally. Yeah. All right. Is there anything else you'd like any incoming public health professional to know about the field?
I think we get into the field because we care and we want to help people. And I think that's the most important thing. And just try to just keep that at the center of everything that, you're trying to do. Sometimes it's easy to get bogged down by, this or that or whatever. But at the end of the day, like you're just, trying to be a good human, helping another good human. So, um, yeah, I think that's why a lot of us get into it. So just don't lose sight of that.
I love that. Well, thank you so much,
Yeah, I
Hannah.
think
And
that's what I got.
yeah, and thank you so much for all the amazing work you've done and continue to do in Colorado.
Yeah, thank you, Katie. Thank you for connecting all the students with all the jobs in Colorado, because without the people doing it, we'd have no public health.
I know. I think public health is the best career path. I really do. I think you get to do so many
Yeah,
cool things and you have so many good skills and yeah.
yeah, absolutely. Thank you.
Yeah,
Appreciate
thanks.
it.